Hi everyone, we're just connecting here. Welcome to this beautiful Wednesday evening. It's Tracy Cartwright here from Karma Life, along with Donna Murray and our guest presenter, Dr Gail Pearson. And we have one curious customer here with us, but we've got lots of questions that, this is a Q&A tonight, so we've got lots of questions we'd like to put to Dr. Pearson. So I'm going to hand it over to Donna, who has got some of our questions prepared that some of the team and some of our customers have asked us to inquire about. I'm handing it to you, Donna.
Thanks, Tracy. Thank you so much for your time, Gail. You are so incredibly generous with your time, and yeah, really appreciate what you do for us. It's really helpful having a doctor on the team. So we're going to do a monthly value add for our customers, just so that they can really start to understand more than just what they're taking in regard to the little yellow pill and the mitochondria, something that helps. And so we thought a good way to do it would be to ask Gail some questions. So here's some of the questions that have come in from customers that can't be here tonight. And thank you, Pauline, for being here with us too. You stand up for 85 to 90 other people. So thank you, Pauline. So the first question actually is, how does it work, Gail, when I take 2 a day of NRF2 when I'm feeling unwell, have an infection? How does that work? And I've actually had that in my own self. I had this huge infection at the side of my mouth with my teeth, and I didn't want to get antibiotics. So I just started downing two NRF2s because I thought that would be a good idea, plus charcoal and other bits. And it just went down within 3 or 4 days, didn't it, Tracy?
Mm.
So why doing the double up when you've got something like that? Why does it work? How does it work?
So if you understand how NRF2 works to decrease oxidative stress. What happens when you're under physical stress or infectious stress or emotional stress? You get more oxidative stress. And what Protandim does is it reduces your oxidative stress by making your own antioxidant enzymes in every single cell of your body. So when you have any condition like that, you're increasing your load. So if you increase your Protandim to 2 a day, and even for airline travel, so to decrease jet lag, it works amazingly. 1 every 12 hours for the NRF2, that's the little yellow pill. And what it's doing is it's troubleshooting and decreasing that oxidative stress, which comes to us when we are in times of stress. And people relate stress these days to, anxiety, but it's not just anxiety. It can be anything. It can be a physical stress. It can be an emotional stress. It can be whatever sort of stress. And that's how NRF2 works to counteract that.
Environmental?
Yes, and environmental. So if you're, for example, I have a few people who are during their spraying periods, they're on orchards and things like that, and all of a sudden they get very sick very quickly. It's really important then that they double up on their dose. So they're taking it 1, 2 a day because they've got an increased toxic load. You've got an increased toxic load. You want to reduce it as much as you possibly can in terms of oxidative stress.
So
well, that's
amazing.
amazing.
Increasing it to 2 a day,
Yes.
How long should they do that for? Is there a maximum time?
No, there's not a maximum, but usually we say between 1 to 2 weeks. So if you've got it like this time of the year, people are starting to get coughs and colds. As soon as you start to get those coming up, I would recommend that you start 2 NRF2 a day. So 1 in the morning and 1 in the evening, increase your vitamin C, get out in the sun to increase your vitamin D, and your immunity is huge.
I've been taking them both at the same time. That's okay, eh?
Well, no, not really, Donna. You're actually much better off to take 1 in the morning and 1 in the evening, because then you're actually spreading the load. So if you take a huge amount, your oxidative stress levels are coming down, but then they're coming back up again. So what you're doing is you're keeping it at a level that's approachable. But having said that, human physiology is different in everybody. And I've found more and more with the more experience I've had with these, that Everybody is different. And that's a recommendation anyway, that one every 12 hours. And that's what they say, because otherwise you overwhelm that NRF2 pathway.
That makes a lot of sense. And just from my own experience of having this happen, you know, just now, that's why I've got my hat on and my warm clothes to keep myself warm. Just incredible. As soon as I started taking 2, I noticed a big shift, a really big shift. It would have taken a lot longer than it has. It's only been, so Friday, so Saturday I started. What's today?
Wednesday.
Yeah, amazing.
You've turned yourself off there, Donna. You're on mute.
Thank you, Gail. Have you got any questions while I look for another one that's been sent through, Pauline? Or are you happy just listening at the moment?
Yeah, no, it's actually really, really interesting, because I was an orchardist and I had chronic fatigue on the orchard. And I wish I'd known about this then, because there was days when I couldn't even get off the couch with chronic fatigue from all the sprays that I was dealing with. And all the neighbours' sprays too from the kiwi fruit. So, yeah, I wish I'd known about it.
I had no idea that you were an orchardist. I had no idea. That was just totally serendipity. So that's obviously to be.
I get the oxidative stress, because that's exactly how I felt, because my cells just felt so depleted. But also when when you're in fright or flight, when you have bad anxiety, as my daughter does, but when you have something bad happen and you have that, your tongue goes dry, your cells are almost drained of fluid. That's it. Is that the oxidative stress that you talk about?
Well, what oxidative stress does is it produces what we call oxygen reactive species, or oxygen free radicals, and they basically damage cells. And you get to a crucial level when the oxygen free radicals, what they call is oxidative stress, because you no longer can cope with it. When you're younger, it's easier. As you age, you can no longer cope with it. And that's called oxidative stress. So that's the way that the cells, if you look at them, it's like looking at an apple that's wrinkled, that's been out in the environment. And so, you cut an apple and it's really nice and crisp, and you put it in the fridge, it's great. You put it out in the air, all of a sudden it's wrinkled and wizened up. And that's what your cells get like. That's exactly what's the inside of your cells. They need more fluid, and they need to have the antioxidant enzymes to be able to counteract that stress.
And that's exactly how I feel when I get stressed.
Yeah,
I can relate to that.
Here's another one from somebody who asked me, why don't you take NRF1 on its own?
That is a good question, and basically that comes down to the way that they work. So NRF1 primarily works at what we call the mitochondria, which you might remember are the little energy or the battery sources within a cell. Now, they produce an energy form called ATP, adenosine triphosphate, and you don't need to know anything about that. But the important thing is that in that process of producing ATP, or the energy, they produce oxygen-free radicals. So what you're doing is, yes, you're creating more energy, but you're also creating more oxygen-free radicals. And if you have not got the capability that the NRF2 gives you to be able to counteract that, then you are on a losing streak. Okay?
I love the analogy of the garage that you shared with me once.
The garage.
The car in the garage, yeah. It gave me a great example of it. You said that NRF1 on its own is like running your car in a closed garage.
Yeah, exactly.
So there's the motors turning. And
motors turning, and you're getting you get the energy, but you're getting a huge amount of pollutant, and you actually kill yourself, basically.
So that you need the NRF1 2 to clean out the garage and open the door and
You need the NRF2 to open up the door so that everything can go out and you can clean it all, so it's all good. And together they actually work together, and it's really quite complicated chemical processes that occur in the cell. But basically, even down to the cellular level, what happens is that the NRF1 will open up the mitochondria so the NRF2 can get in and work at the genes within the mitochondria as well, because we have DNA within our mitochondria. So not only is the NRF2 working in your nucleus, but it also works in your mitochondria, and the NRF1 helps that, as well as producing the ATP energy. So it's a double wham, basically.
But you can take the NRF2 on its own.
Yes, you can.
But not the NRF1.
Correct, correct.
And this is another one. Thank you for that, Gail. That was really good. This is another one that gets asked a lot. Well, when I say a lot, it's like if people have been on, say, the dual synergizer for a little while, and then they say, I don't feel anything. How do I know it's working?
I've got a lot of patients that say to me, I'm really healthy, Gail, I'm really healthy. You know, I go to the gym 3 times a week. I've got, you know, I do the intermittent starvation, healthy diet, don't have any stress in my life. I'm really healthy. You know, I'm not overweight. And I take their blood pressure, it's 220/120. And I said, how do you know what your blood pressure is? And it's the same as what I say to people. How do you know what's going on in your cells? The answer is you don't. But what you will find is that other people who haven't seen you for maybe some years, they'll say you look different. There's something about you. What are you doing? You look different to what you did before. So the effects are often really quite subtle, but we know, because we've got scientific proof, that this stuff actually works at the cellular level as an anti-aging, as to something to give your cells absolute maximum capability to function. So yeah, you might not feel it. You know, my mother is a classic example. She says, I don't feel anything. She looks amazing. She's 87 now. She, you know, the things that she can do now is just phenomenal. Her skin is just beautiful. And yet she has that mind-body separation that her mind says to her, well, no, it's not doing anything. But I can see that it is. And so a lot of people actually need to get over that. They need to get more in touch with their body. And I think that's, these days, we want a quick fix. We want a Botox injection that takes away all of the wrinkles right now, quickly, rather than, you know, I've been on these products now for over a year, and I know that my skin has never, ever been as good, ever, in my whole life. I know that my energy has never been as good, you know, compared to my 20s probably now. I know that my sleep is absolutely phenomenal. So for me, I'm seeing those sort of changes within me, and I'm aging well. The little medical conditions that were starting to creep in, the little bit of high blood pressure, the dry eye, gone, completely gone. And that was actually a quick fix. And what you'll often find is that people, once they stop it, and then they say, oh, yeah, that's right. One of the nurses the other day, she said, oh, headaches. I used to get headaches 2-3 times a week, so severe. She said, oh, and I stopped my Protandim for 3 days, got a headache. I knew then. And she did it again. She got a headache straight back again. So she now knows that that's what it's doing. So some people need that bang on the head to say, listen, it is doing something for you. Another one said, hey, I haven't been sick all winter. Oh, hang on a minute. I haven't taken my inhalers all winter. And so they often don't actually understand what they've actually gone through or what they are feeling, because it is subtle. And that's what I find with most people. But we've got the scientific evidence that it does work, and it's maximum cellular protection.
That's awesome.
Thank you, Gail. Another question I've been asked is, so we've got the NRF1, which is the mitochondria, the energy, the powerhouse. We've got NRF2, which is the antioxidants, which is, so together they're the dual synergizer. And then I've got a question about the tri-synergizer. So now we've got the new one, but I'll ask this first. So we have a ProBio. And the question here is, how long do I take the ProBio for? Okay, so ProBio, what it's doing is it's supplying good bacteria to your gut.
The really good thing about the LifeVantage ProBio is that it's got a capsule around it that will get through the stomach acid, and you will find that most ProBios that you buy at the health shop are broken down in the stomach acid very quickly, whereas this has a 52-minute lifespan, and it will get to the small intestine, the large intestine, to be absorbed and to deposit those bacteria where they're meant to go. So basically, we're learning more and more about the gut biome, and I try and sort of understand the gut as like a sieve. And if you've got a sieve which has got big holes in it, which is called a leaky gut, any toxins or bad things will get absorbed very quickly. If you've got a sieve that's got very fine holes, you do not get toxins that go in. So basically, we're looking to get a non-leaky, healthy gut, because the gut is connected to our brain, it's connected to our heart, it's connected to a lot of other systems in our body. Now, what I also ask people is that, yeah, let's do the gut health. Now, are you going to clean your house once and then think it's going to be clean forever? No, you're not. It's maintenance. You're maintaining the bacteria, because you take a big sugar load and all of a sudden you've changed the numbers of bacteria and the types of bacteria that you've got in your gut. So that's what I'm saying, is that we have to have the appropriate numbers, we have to have the appropriate bacteria, and they have to be in a way that they do not provide a leaky gut, that they keep that gut nice and tight. It's tight junctions within the gut. So yeah, you want to clean your gut once, fine. But if you want ongoing health, you've got to keep it maintained.
Thank you for that. So that's the ProBio. So we've got the NRF1, the NRF2, which is our dual synergizer. And then just this year, we brought in the 3, so the tri-synergizer, which is what has been called NADS. And one of the questions that has come in from somebody who's just started taking it, who is actually a nurse, said, can you take NADS on its own? So can you take it without NRF1 and without NRF2?
You can, but I wouldn't recommend it, because when you start to look at what all the function of the individual ones do and the way that they work together, you are getting a huge amount when they work together. So the NAD works on what we call the sirtuin pathway. And the sirtuin pathway is a series of proteins within the cell, which is increased when you do intermittent fasting. But intermittent fasting, something like 600 to 800 calories per day. So it's pretty severe intermittent fasting. And we know that, starved animals like rats and mice, when we put them in a laboratory situation, they do better when they're thinner than they do when they're fat. Their life expectancy is longer. So the NAD, or nicotinamide adenine dinucleotide, it's a cofactor in a lot of cellular processes. When we do this with the NRF1 and the NRF2, it's like doing and I'm trying to find a really good analogy to understand it, because basically it's like a CEO of the cell. It oversees all of the functions. The NRF2 is doing the cleanup, like takes out all the rubbish and cleans it all up. The NRF1 is providing the energy, and the sirtuin, or the NAD, is doing an overall function and make sure everything works. And together, I can't quite remember the figures, but it's something like 1,800 times more effective with the 3 of them alone, together than alone. So we're looking at genetic levels. We've got even the genes that they characterize are phenomenal. And I can give you those on a specific genetic profile if anyone wants those. So the question is, yes, you can, but it's certainly not going to be as effective as even with the NRF2. If people say, well, that's going to cost me too much money, what can I do? What's my bottom line? I would say to people, clean up your house, do the NRF2 first. Then if you're really short, add the NAD, because that's going to increase your NRF2. Ideally, you want to be all 3, and ideally you want to actually be the ProBio as well. Are we getting into too much stuff? Well, we have these days and age, we're living in a toxic and a horrible environment. We can't control things. And we do need to look at alternative ways of coping with what we are exposed to and bombarded with on a day-to-day basis. And just healthy food is not enough anymore. We need more, and we need genetic activation. And this is what this is doing. It's acting at your genetic level.
Yeah, that's what I love about it, is that it's activating your own cells.
Yeah, so you're doing the healing for yourself. It's
Mm.
not anything that you're putting in that's doing it. It's you are actually, it's telling your own cells what they have to do. These are all dormant proteins that have been there that just need a reboot. Basically, it's turning your computer off and turning it back on again. We're rebooting all of these cells to say, hey, come on, come to the party. You used to do this. Why aren't you doing this anymore? And we want you to do this. And that's the beauty of these products.
Thank you, Gail. That was really helpful. I know the person that asked that question, so I'm sure they'll really find that very helpful information. The next question I've got is about the skincare range. So the skincare range, particularly the anti-aging cream. So it's called anti-aging cream, but with my own very eyes, I've seen it do way more than anti-aging. One of our customers had huge red welts all the way up both arms, on her hands and on her back. And we got her straight onto the anti-aging cream. And over a period of a week, so I saw her when she started putting it on, and then over that week, it was basically so calm on her arms, you could barely see it, still some on her hands. And I was just wondering, like, how does that, I was wondering, I shouldn't take credit for this question. So the question is, why does it work so quickly when it's actually a cream for anti-aging?
So I call it a healing cream. I call it the number 4 healing cream because it's working with the NRF2 genetic activation. And so what it's doing is it's coming down to the deep dermal levels of your skin. And we've got some very good histological, which means histological is when you cut pieces of tissue and you stain them and you look them under a microscope. And you can see the difference between 7 days of the healing or the anti-aging cream compared to a retinol cream. The retinol creams, the cells are all bloated, the nuclei are all disjointed, it looks unhealthy. You look at the ones who have had the healing or the anti-aging cream, the cells look very healthy, the nuclei are all pristine. And that's because it's working at the genetic level. It's got NRF2 activation within the skin cream that gets down into your deep skin layers. And that's why it works so effectively. We're not allowed to promote it for any skin diseases, but what I'm saying is that if you have got anything that is on your skin, use the NRF2 activation on your skin as well with the healing or the NRF2 number 4 anti-aging cream.
Awesome.
Excellent. Thank you, Gail. And then the last question I have is about the shampoo and conditioner. So as well as the skincare range, there's also the hair care. I've actually just started it myself. That's why my hair is looking so gorgeous here. So the question is, where is it? Sorry. The question is, so the shampoo and conditioner, how does that work how does that work compared to normal shampoos and conditioners of a good eco range?
So, you know, I'm not a hairdresser or anything like that. So, but what I do understand, I understand the science. And again, they're using an NRF2 technology and getting down to the, when you have a hair follicle, it's getting down to the follicular level of your hair. And that's where the nutrients are kept, and that's where all the genetic material is kept. So people who use the shampoo will find that the hair has more body, it's got more shine, it's got more bounce. And then they often find that they don't have that when they've stopped it, and then they go back to it again and they say, oh, it's different. And it's different because, again, they're using the NRF2 technology. and completely natural. So and that's what I love about these things, are that everything is completely natural. There is no, even the fillers and things like that, I've gone through them all with a fine tooth comb. There is nothing that is not naturally occurring in these products, and the shampoo is phenomenal. And I might say that the scalp serum is particularly good, especially for dry scalp. People who use revolting things like Free and Lovely and these toxic things that they put on their scalp just because they've got dry skin. Get them to try just using the scalp serum, rubbing it in twice a day, and they will see that dry skin goes very quickly, extremely quickly.
Does the scalp serum come with the shampoo?
You can get it as a bundle, or you can get it separately.
That's awesome. Thank you so much, Gail. Those are all the questions that I had that had come in, one being my own. So that basically covered the tri-synergizers, the probio, the skincare, and the hair care. So that's pretty much the range here in New Zealand, isn't it, at the moment?
Exactly.
With the NRF2. And that's the biggie, isn't it? Is the NRF2 really does, like, by having it in the skincare and having it in the hair care, makes a huge difference.
Well, that was the flagship product, and that was what it was all based on. And now what the company is doing is they say, well, how can we make this better? And how can we make it that, because anti-aging and cellular health is not just one thing, it's multifaceted. And they're constantly looking for things. How can we improve things? How can we do things better? How can we look at other facets of these products? But the NRF2 technology, you will not find products around anywhere that has NRF2 technology. This is foremost, it's leading, it's cutting edge, and we are very privileged to have these products in New Zealand.
So I've got a little question before, is just thinking about the NRF2, because you can get a detox when you begin it, and sometimes at different points throughout. So would the products that you put on externally, do you get any sort of detox from that?
What I have seen with the skin products is that people will often get, especially if they're putting on their face and they've had previous bad skin, they'll get acne coming up. So you detox on your skin. And I've had a few people who just say, nah, it's giving me acne, I'm not going to do it. And the really important thing is with the tablets and with the skincare is to push through. You will get through it. It's like peeling layers of an onion. You tend to go through an initial detox, whether that be gastric with abdominal bloating, diarrhea, maybe headaches. The men tend to get the headaches and the women tend to get the gastric things. Keep going. Once you stop, you feel things go backwards. So, and it's the same with the skin. Bear with it. Just hide yourself away if you need to, for without from people. But keep going, and you push through that. You get another little detox in about 3-4 months, and I've seen this on a regular basis, and people say, oh, this is rubbish, I'm not doing this anymore, look what's happened again. What it's doing is it's detoxing, or your body getting used to it on an even deeper level. And there are detoxes at about a year as well. So all of a sudden you have a pain that you hadn't had for years and years, and say, well, why am I having this pain that I haven't had for years? And what I understand it is that it's your DNA, which has actually got a genetic or a cellular memory, and that comes up after a certain period of time, and it comes up to be healed, and we're giving the body that opportunity to heal that.
It's amazing, isn't it?
Yeah. So be the observer rather than worrying about what you've actually got. Sit back and observe, and be conscious of that observing, be conscious of what your body is doing. And feel your body, because a lot of people these days just don't understand it. And I see it in yoga. And I mean, I've done yoga for years and years, and now people go, oh, you're down dog, I can do this, but they're not actually understanding the essence of what it's all about. And the essence of humanity is to be here, to be in this body, to understand your body, and to embrace that wherever it may well be, whatever faults it's got or whatever it's going through. Observe it and then work through that.
Awesome, Gail. Thank you so much for your time. It's wonderful to have had the questions come in from the customers and to be able to, for you to answer them, because it's so good when they're answered from a experienced expertise level that you come to us with. So really, really appreciative. And I hope that the people that hear this when we put it out, yeah, that a lot of their questions are answered. And of course, you're always willing to answer questions. You're available. It's fantastic.
And I do tend to, I try and simplify as much as possible because it is complicated, and but there are depths of knowledge. And so if people want more depth, I'm more than happy to talk to them on a one-to-one basis. I'm happy with that.
Fantastic. Thank you so much for your time, your knowledge, and yeah, the wisdom that you share from your, obviously from your work experience, but also from all that you've soaked up and are so willing to share with us. Really, really grateful. I think we'll leave it there, and we'll say good night, everyone. And good night. We'll be posting this shortly, so